Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm so pleased you could be with us for this next segment. We're delighted to welcome back to the Monterey Peninsula Dr. Ryan Lehr, dentist. Dr. Lehr, thank you so very much for coming on the program.
Thank you for having me. It's great to be back here.
Dr. Lehr, I read with fascination your brief resume, and this is essentially round 2 for you. This is the second shaking of the apple tree, so to speak. So tell us in summary about your life.
I grew up here, born and raised Monterey Peninsula. Started off wanting to become a dentist in the beginning. When I was about 7 years old, I had terrible overjet. Went and saw the augurs and had a little orthodontic overview and realized I had no chin. And so from day one of my ortho treatment, I was fascinated with dentistry. I got a little off track somewhere around high school and college, and I pursued finance, moved to New York after college, and worked in finance, moved back to San Francisco, and finally said, this is it. I need to go do it because it's what I've always wanted to do. So,
Dr. Lehr, that's terrific. So you grew up here.
I did.
And you're from a medical family.
Yeah, that's right. My dad has been an allergist here since the early 70s.
Of course, highly respected allergist. Well, Dr. Lehr, thank you so very much for being here. You have recently joined a practice here?
Yes.
And where is that?
Monterey Peninsula Dental Group.
Monterey Peninsula Dental Group. And before the end of this segment, we're going to give out your number, contact information, etc.
Perfect.
And we are delighted, of course, to welcome you back to the Peninsula, and I'm delighted you could come on the program. So, Dr. Lehr, I want to ask you a question about people coming to the dentist.
Okay.
It seems that there seem to be a certain number of people, a fair percentage of the population, that have almost a phobia about the pain that they're going to experience when they go to the dentist.
Right.
Can we talk about that? And let's talk about some of the current trends and your approach to helping these people feel more comfortable coming into the office.
Great. And that's definitely a concern that we have, because our biggest concern obviously is patient comfort. What we see, it seems like with a lot of our older patients, is their dental experiences from the beginning they've had some negative experiences. The negative experiences are mostly due to discomfort. Not necessarily the work that we do, but from the anesthetic or lack of anesthetic, and being able to feel, as we're preparing teeth and getting rid of decay. So back in the 30s, Novocaine came about, and it was kind of an evolution in medicine, and we're able to now treat teeth with more comfort, but we still needed something a little stronger. And then came lidocaine in the 50s. Lidocaine was more effective, and it's really been kind of the standard of care up until about 2010. So really recently, it hasn't really changed a lot. It's actually interesting because the local dentist, McFalkel, he's part of the Monterey Dental Group, Monterey Peninsula Dental Group. He, they did a lot of, he's kind of has a background in chemistry, but trying to figure out how do we make the anesthetic a more comfortable experience, the injection a more comfortable experience, because that's really what seems to be the most fearful, what patients seem to have the most fear with. So what it is we're actually putting something into the anesthetic, into the lidocaine, that changes the buffer, and it changes the pH so that it's more similar to what's in the human body. It's going to be a more neutral pH. So when the injection is given, that sting that we feel is greatly reduced, if not felt at all. Plus, the anesthetic is more effective because more of it is being used as an anesthetic rather than used up in the transition from a low pH to a high pH. So now we're able to give a more comfortable injection, and patients realize now after coming back to the dentist that it really is a much more comfortable experience than it ever has been.
Well, Dr. Lehr, on occasion, a dentist will give a patient an option.
Right.
And they'll say, would you like to be numbed up, or would you like to get a block, or shall we take care of this cavity without a dental block? Right. Isn't that correct?
That's right.
Now, so So even without a dental block, it seems to me that with different drills, higher speed drills, et cetera, different techniques, that you're able to take care of a problem tooth in a much more comfortable way than has been done in the past.
Right, and that's true up to a point. Okay, we're limited, when decay gets to a certain point, we are forced to numb the patient in order for them to not experience pain or discomfort. Because we're able to detect caries and the bacteria in the teeth so much sooner, we can be minimally invasive in our preparations of the teeth. And because of that, we don't necessarily have to get the patient numb every time. Okay, so if the caries, the decay, if it's shallow enough, we're just kind of on the top surface of the tooth, we can avoid having to numb the patient, and we can take care of it, without any discomfort.
Perfect. Okay, so Dr. Lehr, let's say that we've anesthetized the patient and the patient is comfortable. Right. I want to change the subject just a little bit before we talk about cosmetic dentistry.
Yeah.
A lot of people seem to be concerned about the substance that's used to fill a defect after a cavity is removed.
Right.
The amalgam or the mercury, or they wonder if gold is going to get into their bloodstream, and if they get mercury into their serum, is it going to poison their nerves? So can we address that issue of the substances that you use for fillings?
Right.
Are those substances safe? Is it okay that micro amounts might get into the bloodstream? To talk about that for a couple minutes.
Well, it's a topic that's been up for debate for a long, long time. And in some countries, they've made the amalgam fillings, which is an alloy, which contains the mercury. That's the silver fillings that you see when, the old fillings that we used to get back in the day. And there's been a lot of discussion whether or not those are safe. There's never been anything proven that shows, any real studies that show that mercury is something that, you're going to be at risk for any kind of mercury poisoning. That being said, and I could go into it, but again, there's so much kind of back and forth in the topic that, it's a long discussion. But the big thing with those big silver fillings, and some dentists are proponents of getting rid of them. Some dentists, they're more conservative and they want to wait, until they need to be replaced over time. The big problem with those fillings is that we can't be as conservative with them because they require a certain amount of tooth structure to be removed. So because of that, the composites that we have now, which is the tooth-colored filling, they're able to bond around the tooth and bond to the tooth. And because of that, we're able to be much more conservative in our preparations. So the real advantage there is being conservative in the beginning so that down the road, when a filling outlives its useful life, we can then replace it with another filling instead of doing something more drastic.
Okay, well, that sounds like very clear, cogent thinking. Now, a whole other topic that we can address, maybe you'll come on the program again, is cosmetic dentistry.
Okay.
Everybody wants a pretty smile.
Right.
As a plastic surgeon, I see people that, of course, they're concerned about their appearance. They want good-looking teeth.
Absolutely.
They want a pretty smile. So let's touch on some of the recent advances and some of the major issues in cosmetic dentistry. Let's start by saying, let's say a patient comes in, let's say a 50-year-old woman, and she says to you she wants a more attractive smile.
Okay.
What do you start with?
Well, the most obvious thing, and I think something that a lot of the dental companies out there have tried to market in some way or some fashion, is wider teeth. Because without doing anything very drastic, we can achieve wider teeth. Okay, we can get that wider, brighter smile. Okay, and there's a number of different ways we can go about it. It's a very it's minimally, we're not being invasive at all. We're just applying a basically a kind of a bleach to the tooth that allows to take away some of that surface staining and some of that that stain that comes from age, that comes from beverages that we might be drinking, and it's something that happens over time. So we can get back to that youthful white smile. And there's a couple different options for that. There's in-office bleaching, which is it's a little more, I guess, high-strength bleaching. We can achieve results more quickly. There's also trays that can be fabricated by your dentist, and what we use those for is we can actually put the bleach in the trays, let the patient take them home, and whiten at home. The good thing about that is we're able to let the patient be in control of the shade of their teeth. Okay. The other alternatives are over the counter. There's white strips you can buy, which you apply to the teeth, and over time you'll get similar results. So it's a great starting point. But then a lot of people want that next step. Okay, and the next thing that's really just been revolutionary is aligner therapy and getting teeth in the right shape in the arch. Okay. And there's so many, we could do a whole program on orthodontics and alignment, but most people are familiar with Invisalign. And, your general dentist and your orthodontist can both do it, assuming, they have the certification to do it.
Well, Dr. Lehr, I'm familiar with the term Invisalign, but I'm not certain I know exactly what it is.
Okay.
So let's take a couple minutes and teach our audience what we mean by Invisalign.
Perfect. So Invisalign is a specific company, okay? But the more general term, it's kind of been associated with Invisalign, but it's aligner therapy. So instead of attaching, and I should have brought some models with me, but instead of attaching those silver brackets around the teeth.
Now, excuse me, if you don't mind me asking. Now, when the kids talk about braces,
right?
Now that's what we're talking about, right?
This is kind of the alternative to braces. Okay, this is the next step in orthodontics. This is how things have kind of evolved. So now we're able to treat tooth movement and malocclusion instead of brackets and braces, the big metal, things you see that are hard to clean. They've got wires that go across. They can stain the teeth. Now we're putting a clear, kind of a suck down. It's almost like a clear retainer or a bleaching tray. That's what it looks like. And they're virtually invisible. We're able to get we were able to basically see the end result before we start the treatment. And that's the miraculous thing, is that we know from day one where we're going to be at the end, at the termination of treatment. So we know the results we're going to get, and we know what to expect along the way. So we can use this in so many ways, from getting patients to have the right bite, to have the teeth, apply the correct occlusal forces so we don't damage them in the future, but also assist us with implant cases where we can get the teeth correctly aligned to be ready for an implant. We can get the teeth aligned correctly so we can do cosmetic cases more effectively and more efficiently. And a lot of patients who didn't have the advantages of orthodontics, who weren't able to get orthodontics as a child, can now, at the age of 50, 60, 70, 80, they can have their teeth realigned. And it's been miraculous. It's an amazing option.
Okay, so more and more adults are coming in and they want teeth realignment, or they want alignment of their teeth corrected.
Right.
Dr. Lehr, before we go on, I understand, I've heard that in many high schools, braces, so-called braces, it's not sort of a topic of ridicule anymore. They used to call these kids, tinsel teeth and all that stuff. Now it's considered kind of hip and cool that the kids are wearing this hardware on their teeth, which I think is great, that they're not being they're not poked fun at anymore, they're not ridiculed.
Right.
Because they're doing something positive for their health and their appearance.
Right. I would agree.
So, Dr. Lehr, let's talk a little bit. Unfortunately, we don't have all that much time left, but I want to talk a little bit about preventing problems.
Right.
I want to talk about preventing caries.
Okay.
When should a patient come in to have teeth realignment? Should they wait till they're an adult? Should they start that preschool? Or I should maybe the answer is when they get their adult teeth. In other words, what's the time for that? How can we prevent problems? And if we have time, I want to touch on this topic about fluoride in the water to prevent caries.
Okay.
So let's start by talking about preventing dental caries. Is it possible to do that?
It is, and actually, one of the important things that we need every dentist talking to their patients about when we go through treatment, fluoride needs to be discussed, and the different options need to be discussed, because it is extremely important that patients understand the advantages, and they've been proven. The ADA has come out and said that we have a 40 to 70% reduction in caries with the proper use of fluoride. Okay? The problem with just thinking about fluoridated water and avoiding fluoridated toothpaste is we're not getting the amount of fluoride needed. Okay? So, and it's a very minimal amount. And the fluoride in the water is such a low part per million that it's just not going to provide sufficient fluoride. So they've added it to toothpaste, they've added it to mouth rinses. But for certain patients, depending on their dental history, if they've had a lot of restorations, if they've had crowns and they've had fillings, they're more susceptible. Elderly patients who don't have the dexterity, who can't brush as well, they're more susceptible. Different medications can make patients more susceptible to dental caries and recurrent decay, which is decay underneath a restoration that was placed at one point in time. So the addition of highly fluoridated toothpaste, which are usually prescription toothpaste, is something that really needs to be discussed with patients who are maybe need that little extra dose of fluoride. Also, there's some great mouth rinses out there that patients can buy over the counter that will give them an added fluoride benefit. And the thing with fluorosis is it's not, we've controlled the fluoride intake at the pediatric level. We're not going to worry about it too much after development. So fluoride should be utilized. It's a great tool.
Perfect. Dr. Lehr, we're coming up to the point where I'm going to have to ask you to come back again.
Okay.
So I do want to give out your contact information. Then I'm going to ask you just briefly to tell us what's the ideal age that people can come in for dental realignment. So Dr. Ryan Lehr, welcome back to the Peninsula.
Thank you. It's great to be back.
373-3068. And
correct.
Where's your office located?
333 El Dorado Street.
So that's the big
Monterey Peninsula Dental Group.
Dental complex on El Dorado.
That's
Dr.
right.
Ryan Lehr, Monterey Peninsula Dental Group. Now, just tell us in summary, briefly, when is the ideal time to get dental realignment? If you become 50, is it too late?
No.
Should they bring in the kids, adolescents, 10 or 12? What's the...
There's a good, there's a difference between pediatric and adult orthodontics. And the pediatric dentists in the area are phenomenal, and they're going to stay on top of, when should that child in particular go to the orthodontist. There's different stages, different phases that they go through. With adults who have all their adult teeth, it's a much easier process. We come in, we can do it right from the hygiene check where we look at their teeth, and in a couple minutes we can tell you are a candidate for aligner therapy. Okay, or you might need a little something that is a little more severe, in which case we refer them to the orthodontist. And doing a lot of Invisalign, we become more aware of malocclusion, and so the referrals to our orthodontist has gone up. And also we're able to do a great service, and patients love it.
Perfect. And so if you get to be an adult age, it's not too late.
We did Invisalign on an 85-year-old lady, and she was happy as can be.
Then you send her over for a facelift.
That's
Excellent.
right.
Dr. Ryan Lehr, dentist, 373-3068. Thanks so very much for coming on the program. I hope you come again.
I will.
Once again, this is Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. We're coming right back after a very brief pause for a very good cause.